Good morning everyone. So today I will discuss about the neonates and infants. What is infants and neonates? So, the process of biological human growth passes through the various stage. Two initial stage are known as infancy and newly born. It goes through the natural cycle of development. A neonate is also called a newborn. It defines a child who is 0 to 30 days old. This very critical stage of baby is during this time because the body goes through the immense physiological changes. The respiratory and heart rate of newborn is much faster than of adult. While the infant, it is generally used to refer a baby who is aged between 1 month to 12 months. Infants start learning through the senses and they also start feeling the trust factor. So now let's move on to the next slide, which is health screening. What is health screening? So health screening are tests that look for disease before you have symptoms. Screening tests can find disease early when they are easier to treat. Newborn screening refers to a set of special tests, including blood, hearing, and heart screening, done to 1 to 2-day-old infant, usually before they leave the hospital. The test can often scan for genetic and metabolic abnormalities, hearing problem, specific heart problem, and other conditions that can hinder their development. Infants. Besides following general home safety tips and childproofing your home, below are safety tips especially for baby. So first, bathing. So bath a baby in specially designed, sleep resistant, infant bathtub. Fill tub with 2 or 3 inch of warm, not hot water. So, bathing is the washing of the body with a liquid, usually water, or the immersion of the body. Second, nursery. Remove mobile when baby can sit on his or her own. Remove bumper pads and shift crib mattress to lowest position when baby can fall to standing position. Keep bassinet position away from window, heaters, lamps, and other furniture. So, in addition, a nursery a bedroom within a house or other dwelling set aside for an infant or toddler. So third, which is feeding. So, provide safe finger foods such as bananas, well-cooked pasta, and vegetables. Keep items such as coins, buttons, balloons, safety and rocks out of your child's reach. Follow each recommendation on toys, especially those with small parts, and make sure your toys are in good repair. So, in addition, feeding is newborn babies should breastfeed 8 to 12 times per day for about the first month. So now let's move on to the next slide, which is infant screening and immunization. Infant screening and immunization. Immunization, also called vaccine. It's an important way to protect an infant health. Vaccination can prevent more than a dozen serious diseases. Failure to vaccinate may mean putting children at risk for serious and sometimes fatal disease. Infants are particularly vulnerable to infections. Baby needs their first injection at 8 weeks, then 12 weeks, 16 weeks, and 1 year. These screening tests are recommended by National Health Service because results from these tests can help make sure that your baby is given appropriate treatment as quickly as possible if needed.
The newborn screening program checks babies shortly after they are born for more than 50 rare and serious conditions. Together with hospitals, clinics, midwives, specialists, and families, we work towards giving every baby born in Minnesota the opportunity to start life healthy. Newborn screening includes blood spot screening, hearing screening, and pulse oximetry screening. Hearing and pulse oximetry screenings happen at the place of birth. The results from these are available the same day as the screen. For blood spot screening, a nurse takes a few drops of blood from the baby's heel and puts it onto special filter paper. These blood spots are then sent to the newborn screening lab, where lab workers test the blood spot for a number of disorders that can cause serious health problems and even death. If the blood spot screening results are within normal limits, we send a report back to the birth provider. If the blood spot screening results are abnormal, we contact the baby's provider, we share what was found on the screen, what follow-up is needed, and when that should be done. Minnesota has about 200 babies born every day, so the newborn screening lab is always busy. Between the blood spot, pulse oximetry, and hearing screenings, about 450 newborns are identified every year with a condition that is on the screening panel, and they can then begin to receive treatment. Thanks to the Newborn Screening Lab and its partners, Minnesota newborns can start their lives as healthy as possible.
Infant safety. Having a clean and sanitary environment is very important for babies. One of the most important steps that parents can take is to make sure that everyone who handles their child has washed their hands. Okay. In terms naman po sa kalinisan, in terms naman po sa pagiging malinis, so we always sanitize our hands kasi po marami po tayong nahawakan na marurumi, so pwede po maawa yung baby. So when you change your baby, make sure you put them down in the safe place. For example, change the table with raised heights to prevent the baby rolling off. Remember to keep one hand on the baby at all times. Never leave your baby alone the change table. To prevent falls, some parents chose to change the baby on the floor. Tips for baby safety in the home: prevent scalds in the bathroom, reduce the temperature of the hot tap water in the basin, bath and shower to 50 degrees Celsius, 50 degrees Celsius, or feed and thermostatic mixing or tempering bulb. So, sabi niya dito, check muna natin yung check muna natin yung temperature ng water with 50 degrees Celsius para di po mabigla yung katawan ng baby. So, be aware of foods that can choke children such as lollies, of meat and nuts. Kasi may mga aksidente po tayong may aksidente nalunok yung mga baby na mga candy or anuman. To prevent choking, choose age appropriate toys with no parts of the toys smaller than D size battery. Check toys regularly for any small close or close parts. Small parts can be hazard and can choke in child less than 3 years of age. So, choking and chemical intoxication. So, choking agent poison happen when you are exposed to harmful chemical such as poison or chlorine. Poison is used to make dyes, plastic and pesticides. Chlorine is used to keep swimming pool for water clean. You may accidentally be exposed during a fire or chemical spill. It may also be used as a weapon. Choking agent may cause severe symptoms and be life-threatening. Signs and symptoms may occur immediately or up to 48 hours after exposure. Burning or TRIs. Burning or teary eyes. Burning feeling in your nose or throat or on your skin. Nausea and vomiting. Coughing or wheezing. A rate that is faster than normal for you. Coughing up bloody film. Painful breathing or shortness of breath. So what should I do if I am exposed to a choking agent? So move to higher area. So climb to the top floor of the building or go to the top of the hill. Push against the heavier than hair and will settle in low-lying areas such as ditches and basement. Turn off the heat or hair conditioning to prevent the choking agent from circulating in the building. Remove your clothing. Remove clothes that have the choking agent on them. Do not pull clothing over your head. Remove your clothing. Remove clothes that have the choking agent on them. Do not pull clothing over your head. Cut it or rip it off your prevent getting choking agent in your eyes, nose or breathing. So remove contact lens. Place all contaminated clothing and contact lens. Place all contaminated clothing and contact lens in a plastic bag and seal it. Ask your healthcare provider if and how should dispose and bag. Wash your entire body and take a shower as soon possible. Use soap and water or cleaning solution. Provide healthcare providers. Care agreement. You have the right to help plan your care. Learn about your care conditioning and how to it may be treated. Discuss treatment option with your healthcare provider to decide and that your care you want to receive. You always have the right to refuse treatment. The above information to the nutritional aid only. Is not to intend to medical advice for individual conditioning or treatment. Talk to your doctor, nurse, or pharmacist before following any medical reasoning to see if it is safe and effective for you. Okay. Talk to your doctor, nurse, or pharmacy before following any medical reasoning to see if talk to your doctor, nurse, pharmacy before following any medical reasoning to see if it is safe or is effective for you. So nutrition in the study of nutrients, food, how the body uses, then the relationship between diet, health, and disease. Nutrition all focus on how people can use dietary choice to reduce the risk of disease. What happens if a person has too much or too little or nutrients allergic word. Nutrients provide nutrition, protein, carbohydrates, fat, vitamins, mineral, fiber, and water are all nutrients. If people do not have the right balance of nutrients, in their diet, their risk of developing certain health conditioning increases. Breastfeeding and introduction. First foods. Since most breastfeeding babies' iron start begin to diminish at about 6 months, good first choice for solids are the rich in iron. Current recommendation are the meats such as turkey, chicken, and beef, and should be added as the first solids to the breastfeed. In fact, diet meat are good source of high quality protein, iron, and zinc, and provide greater nutritional value than cereals, fruits, or vegetables during the second half of the year. Your breast milk will continue to provide the great majority of necessary nutrients as the start of sample variety of new foods. Thus, your baby will know that greatly enjoy an introduction of new tastes and textures in her life. Her experience with solid food are still just practice session or the future. It's important to make sure she's continue getting enough breast milk to meet her nutritional needs. That's all po.
My name is Liza Lagur, and now the topic that are given to me are elimination, rest and sleep, routine sleep, and sensory stimulation. So first is elimination. So elimination is the eliminating disagreement in a group is usually beneficial to the social stability. To be specific, we intentionally introduce weak random noise to only one agent to affect its opinion in the evolution, and also a leader agent with fixed opinion in a device group. So the example is removing the use of hazardous chemical is an example of elimination. Some substances are difficult or impossible to eliminate because they have unique properties necessary to the process. So the next is rest and sleep. So the rest and sleep, having a good quality sleep and regular rest breaks can have many benefits for both our mental and physical well-being. Good sleep boosts our immune system, emotional resilience, and help us deal with anxiety. So the example or the importance in rest and sleep are the lower weight gain risk, better calorie regulation, greater athletic performance, lower risk of heart disease, and preventing depression. So next is the routine sleep. Next is routine sleep. Sleep routine are activities before bed each night. Routines can improve the quality and length of a sleep. Why is routine important for sleep? Keeping a regular sleep schedule, even on weekends, maintains the timing of the body's internal clock, and it can help you fall asleep and wake up more easily. So next is the sensory stimulation. So it is the input and sensation you receive when one or more of your senses is activated. By stimulating the senses, particularly the visual sense, learning can be enhanced. So sensory stimulation activities can include, so these are the giving a gentle hand massage, taking a short walk outdoors to provide a change of scenery, talking or reading aloud to the senior, organizing pets to come for visits, and cooking their favorite meal.
My name is Quezal Joy Soligario. The topic that are given to me are health screening, health promotion guidelines for toddler, health examination, and protective measures as to toddler safety. Okay, number 1 is health screening. Screenings are tests that looks for disease before you have symptoms. Screening tests can find diseases early when they are easier to treat. You can get some screenings in your doctor's office. Others need special equipment, so you may need to go to a different office or clinic. Number 2, health promotion guidance for toddler. Health promotion should accumulate at least 60 minutes of daily structured physical activity and engage in at least 60 minutes and up to several hours of unstructured activity daily. It is recommended that children in this age group not be sedentary for more than 60 minutes at a time except when sleeping. Number 3. Health examination. In a physical examination, medical examination, or clinical examination, a medical practitioner examines a patient for any possible medical signs or symptoms of a medical condition. Number 4. Protective measures as to toddler safety. Keep children's play areas away from your kitchen. Keep hot drinks away from children and never hold a child while you have a hot drink. Keep children away from hot foods and liquids. Put all hot liquids and foods in the center of the table or to the back of the bench away from the edges.
So hello, to continue to our discussion for this morning, I will tackle about nutritious meals and snacks. So healthy eating, what does it means when we say healthy eating? So it is eating or taking a variety of foods so that your child gets the nutrients he or she needs for normal growth. So what are the nutrients we can get in taking healthy foods? So we can get protein, carbohydrates, fats, vitamins, and also minerals. So if your child is taking if your child regularly eats a wide variety of food, he or she will be well nourished. So how much food is good for your child, or how much food does a toddler need in every feeding we take for them? So at year one, solid food including healthy snacks are your child's main source of energy and nutrition. So your child or a child can take between 3 to 1 cup of food 3 to 4 times a day, plus 1 to 2 snacks between meals. So, palagi nating napapansin na every child is humihingi sila ng pagkain pag sila ay nagugutom, and it is normal for a toddler or a child to ask for a food when they are hungry. So toddlers need between 1,000 to 1,400 calories a day depending on their age, their size, and physical activity level. So some of them are considered active naman. And the amount of food for toddlers requires from each of the food groups is based on daily calories. Needed for their body. So with babies and toddlers, we can usually leave it to them to eat the right amount of food at each meal they want, or as long as they make only healthy foods available. So alam po ng mga bata if how much food they need for their body and how much nutrients or how much food they need to intake for their body to take the nutrients they needed. Next is the elimination. And elimination communication is about the learning when a baby is about to go and helping them to get to an appropriate spot. So each baby is unique and can have a different elimination pattern and still be healthy. So we as a caregiver or as a student nurse, we should consult the baby's doctor if they have any questions or concerns. Next is our toilet training. So toilet training is sometimes called toilet learning or potty training. So it is the process of teaching a young child to control their bowel and bladder and use the bathroom for elimination. So madami tayong nakikita na some of children around 2 to 3 years old ay alam na po nila ang pagpunta sa CR para doon sila doon sila mag-eliminate ng dumi at doon din sila maglabas ng ihi. And a child is considered to be toilet trained when he or she initiates to going to the bathroom and can adjust clothing necessary to urinate or have bowel movement. So, at that age or a toddler's age, parang nalalaman na nila kung kailan sila kailangan pumunta sa CR or sa bathroom to take their elimination or bathroom elimination. So, even before a child is ready to try the potty, you can prepare a little one by teaching about the process. So, some of the process na pwede nating ituro sa mga kabataan in taking their potty process is using words to express the act of using the toilet. So, halimbawa, sa pag-ihi. So, sinasabi nila, Mommy or Ma'am, I want to pee. It is a word that is used na parang sinasabi nila na kailangan na nilang umihi. Or sometimes it is poop, like paglabas ng dumi, yung ganyan, and potty. And also, ask them to let you know when diaper is wet or soiled. So, meron ding iba or ibang parents na tinatanong nila ang kanilang anak na basa ba yung diaper mo or may laman na ba yung diaper mo? Kasi sa doong pamamaraan na natitrain din natin yung mga bata to say if they have already released or eliminated their dirt. And next is identify behaviors so that your child can learn to recognize the urge to pee or poop. So, pwede din natin gamitin yung pagtatanong sa kanila if natatai na po ba sila, naiihi na po ba sila, which can help them to know if they are urged to pee or to poop. And lastly, get a potty chair for your child that can practice sitting on. At first, your child can sit on it wearing clothes or a diaper. So in having a potty chair, hindi siya kailangan na minamadali natin. So by step by step process tayo. Halimbawa, binigyan mo sila ng potty chair. So pwede 'yon na gamitin muna nila na mayroon silang damit or mayroon silang diaper first para masanay sila sa paggamit nito. Next is we will discuss about the rest and sleep. So sleep is an essential part of everyone's routine and an indispensable part of a healthy lifestyle. So studies have shown that kids who are regularly get an adequate amount of sleep have improved their attention, behavior, learning, memory, and overall mental and physical health. So, ilang oras nga ba ang dapat o ang kailangan na tulog ng isang toddler o isang bata? So, toddler should have 11 to 14 hours of sleep. So, ano nga ba ang mangyayari if yung isang bata ay hindi nakakakuha ng enough na tulog or enough sleep? So when a child lacks of sleep, it commonly causes irritability or mood swings. So napapansin natin na yung mga bata, pag kulang sila sa tulog, madalas sila ay irritable or parang hindi palagi silang umiiyak or yung ugali nila is hindi natin maintindihan. Sleepiness can also affect the child's ability to pay attention with ramifications for their performance in school. And lastly, we will discuss about the play. So, play is the work of children. It consists of those activities performed for self-amusement that have behavioral, social, and psychomotor rewards. So play is an important part of the childhood development. Through play, children learn about shapes, colors, cause and effect, and also themselves. Play is direct opposite of work. It is frivolous. It provides freedom and invites the impulse to engage in foolishness. Yet it provides a means for ego development and a process by which social and physical skills develop as well. So, itong play is isang importanteng parte ng pagiging bata. Dito natin, in this part, a child will learn how to identify shapes, how to identify colors, how to learn saying words like being grateful, asking for forgiveness, like that. And it is also a way which they can socialize with other children, or dito nabuboost yung kanilang self-confidence in talking to another children. In playing, parang dito nila nade-develop yung mga social skills and also physical skills na maaari nilang magamit sa kanilang paglaki. And yun lang po ang sa aking report ngayong umaga.